Good morning. It's great to be here in Ferguson today. In November of 2017, a clinic offering primary care to Ferguson and other North County communities opened in the building right next to me. Thanks to donated space by Schnucks, support from Centene through its subsidiary Home State Health, the Betty Jean Kerr People's Health Clinic was able to expand its services to thousands of residents in North County. But as the pandemic reached our region earlier this year, the clinic had to close to protect its staff and to protect its clients. So today I'm happy to be here for the official reopening and for the launch of People's COVID-19 Mitigation Outreach Program. Here, People's staff will pass out PPE and masks provided by the St. Louis County Department of Public Health. Residents will be able to get information on expanded COVID-19 testing sites offered by Peoples, and also education materials on how to prevent the spread of this virus in our community. They can get information on options for insurance access and how to make medical appointments at one of People's clinics. During normal times, the power of partnerships such as this between Schnucks, Centene, and Peoples go a long way in helping to link residents with important healthcare services in their community. During extraordinary times, these partnerships are critical to increase access to healthcare during a healthcare crisis. So I'm honored that St. Louis County has joined this partnership by providing PPE and a $578,000 grant to Peoples to expand testing in North County. The funds come from a CARES Act grant that was provided by the federal government to St. Louis County in response to this pandemic. You can follow the spending of these funds at our transparency portal at stlcorona.com. It's my honor today to introduce Dwayne Butler, CEO of People's Health Centers, to talk about the great work of his nonprofit and the expansion of COVID-19 testing in Ferguson and for our North County communities. Dwayne.
Thank you, County Exec Dr. Page. Good to see everyone come out today. This is a very exciting time for us. More than a couple of years ago, we partnered with Centene and Schnucks to begin to address the disparities of health in our Ferguson community. That's been a very successful operation, and now with Dr. Page and the county joining us in the testing program, being very generous in the grant that they offered us to do testing in the community, we thought it was a great time to actually bring these programs in concert to serve the community's COVID threat. What we're looking at is addressing the COVID threat in the Ferguson community and in our underserved communities in chief from beginning to end. It's our goal with this center itself, with the help of Centene and Centene Home State and the county, as well as Schnucks, to deal with the fact that we really should try to mitigate COVID. Hopefully we don't get COVID in the first place. So many of the activities that will occur here at our Schnucks site, and that will be Monday through Friday, we'll be handing out PPE to the community, teaching the community how to use it effectively, handing out PPE information on COVID, also information on where we'll be testing. It's important also that we don't forget chronic illness in primary care as we address the issues of COVID. So we'll also be encouraging the community to get back engaged with their primary care doctors. We'll be making appointments for those who would like to have appointments with primary care doctors because we're going to have to walk and chew bubble gum at the same time. We're going to have to deal with COVID, and we're going to have to make sure we take care of our health so that the long-term health of the community is addressed and handled. So I'm very pleased that the county saw fit to give a substantial amount of money for us to broaden our testing program in North County in chief. And we're excited about that because that will grant access to many who did not have opportunities to test to now get tested. And that's a mobile testing platform, so we'll be in many different places throughout the week. And you can come here or call the county Department of Health and find out where we'll be testing in your area, in your neighborhood. But at the same time, when you visit Schnucks and come get your household groceries, you'll also have an opportunity to address the mitigation importance of the COVID the effort in itself. And ultimately, our goal is to educate the community on the importance of wearing masks how to wear a mask, washing hands, and doing all the other things that we can control to ensure that we never bring COVID into our homes in the first place. So this will be a hub of information, a hub of COVID PPE related materials so that you can protect yourself, show you how to use it, and again, re-engage you in primary care. The ultimate goal of this facility from the beginning has been to bring much needed health care to this community in a very accessible way. So this very potent partnership with Centene Home State Schnucks and the County Health Department under the leadership of Dr. Page is going to be one that I believe is going to be a great benefit for the community in the short term in addressing the COVID threat, and in the long term in addressing the overall health needs of this community and the health disparities that have manifested itself in a very devastating impact of COVID in the first place. So we're very thankful for our partners, and we thank you all for coming out. We look forward to a very successful run here in our COVID mitigation efforts. Thank you. I know that Nathan here from Home State, Nathan over here from Home State Centene, who has been a great supporter and an architect of this program, is here. So Nathan, I don't know if you had a couple of words.
Thank you, Dwayne. I'm Nathan Lansbaum. I'm the CEO of Home State Health, a division of Centene Corporation. It's a great day for the Ferguson community as we reopen, and the community now still has access to the People's Health Center by Home State Health. You know, when Dwayne was considering the temporary closure of this health center, he gave me a call. And I knew it was a very difficult decision for him, and one that he contemplated over for a long time. But it was the right decision at the time, and we supported him. So I know Dwayne is very excited that the health center is reopening, because he and the staff at People's Health Center know that access to quality health care and COVID resources is so important at this time. Another partnership that we're very proud of with People's Health is the COVID-19 testing partnership that we have, in which we provide 1,000 Quest COVID-19 test kits each week. Home State Health will continue to do our partner, to be a good partner in the community, to provide those COVID-19 testing kits, because it's so critical in this time. Health centers like People's Health Center provide care to thousands of residents, our most vulnerable residents in our state and our city. And providing those testing kits is incredibly critical to continuing the health of our community. Thank you very much for being here, and thank you for allowing us to be a part of it. Thanks, Dwayne.
Well, thanks, Nate, Dwayne, for all you're doing to improve access to health care and to fight the COVID pandemic in our region. We'd be glad to take any questions.
Got a couple for you, Dr. Page. With the expansion of testing, does that mean it's going to possibly be testing the students and teachers who go back into the schools on August 7th?
I think it's important that we focus testing where it will give us the most information and change a decision that we would be making. And so we want to be cautious about testing widely without a good indication, but I'll be following the advice of our public health officials and our hospital and health systems on how to direct the testing, how to support the schools in their reopening plans when they move from all virtual to some sort of hybrid model. We'll support the Jennings School District and what it's doing with a hybrid model, and I'll follow the advice of our partners in the community, People's Health Centers and the other FQHCs, as we determine the best place for those resources and how to get the most out of them to prevent the spread of COVID in our community. We do think testing will be a part of our school reopening plans, but we're going to wait and follow the advice of our public health experts and the pandemic task force on what that looks like.
A few other overall questions I have for you. Since making it a requirement to have these bars closed at 10, have you all seen a decrease in numbers, especially when it comes to the young people? Because I know that was kind of the focus of that closure.
Well, we know that closure is important, and we generally don't see a change in any sort of trend until we have had some sort of mitigation effort in place for 2 or 3 weeks. But the growth of the increase in COVID in our community is planing out some. I'm sure that all of the mitigation efforts we've made, masking, closing bars at early in the evening at 10, and limiting the capacity of all of our businesses has helped. I'm sure it's helped some. And we're seeing some flattening of that. We're watching the information from the Pandemic Task Force, the hospital admissions data, the ICU admissions, ventilator usage, and all of those things to determine if we need to make any changes in our public health restrictions. But we have seen some flattening of the infections. Our infection rate remains about 8.5% of all of our tests. We're testing 2,800 a day on average. Our weekly average, we look at that once a week, is 2,800 a day, and we're running about 8.5%. We still don't have as rapid of a turnaround on the tests as we would like, and that's due to the national surge of testing, and some of our testing centers are overwhelmed. We really would like to see a quicker turnaround time on some of our tests, and we're all working to get there, but we understand the national situation that we have right now.
Last one for you. Any difficulty in compliance? I do know that, obviously they have to close at 10, but they serve food, these bars serve food, and they stay open. Do you think some businesses are serve food are going to stay open? How is that kind of working when it comes to compliance?
I'm leaving those details up to the health department, working with our attorneys in St. Louis County. The vast majority of folks, once they receive a phone call from us and some guidance on what they should be doing, they do it. We have very little folks who want to be confrontational about what the right thing to do is. We do have some complaints. We do have a few outliers, but for the vast majority of those are responding very positively to some guidance from our health department and from our county attorneys, and I expect that to continue. Any other questions? Doug, do you have anything? Okay, thank you.